two articles. This is an article that Dr. Agashi also showed from Dr. Babulkar's unit about managing unstable fractures. And this is the case from their series where they talked about the lateral wall fracture and the necessity of doing a CT scan and their classification of that we heard Dr. Kulkarni mention. And they used their method of doing a tension band wiring and reconstruction of the lateral wall with a proximal femoral nail. The second paper, again from Dr. Gadegone's unit, and Dr. Shivashankar is also there. He talked about the need for this kind of fracture and the need for a lateral wall reconstruction. So my counter to that would be a similar case like this. So I would uh, like to believe that my colleagues would look at this X-ray, and it's a fairly comparative X-ray. And this is what I have done. So as I kind of the first premise that I do in all these my reductions is I need to make sure that there is valgus as well as the lateralization of the shaft, and anteriorly I get a good bone-to-bone contact, and that's the healing at 3 years down the line. Patient walk the next day or with weight bearing as much as tolerated. Next case, another case from Dr. Gadigone's paper. Again, they talked about this plate. Now, in this case, they were not happy with there was too much combination, I would have liked to think, and therefore they felt that reconstructing this with an additional plate of this kind is what I came across, and this is the healing. Now, in spite of the lateral wall, there is still a collapse of that as seen by the back out of the two screws. A similar case that I would kind of put in again, there is a combination of the GT, and this is a reduction. Now, that tip of the GT is way out, but again, if you valgize the head and neck, you lateralize the shaft, and you get that reduction, that is a 1 year down the line, and again, no complaints. Why? How about something more challenging like this, where it is felt that no, the lateral wall is badly comminuted and the GT is also gone. So in this case, definitely you would require some sort of a lateral wall reconstruction. Third case of similar kind, friends, you would agree